Hello, I am Dr. Ajit Mehta. I am an interventional cardiologist working at Jahangir Hospital, Pune. If you see global statistics, the prevalence of the heart disease is increasing day by day. And especially in Asians and Indian population, the prevalence of the heart disease is very alarming. In fact, we in Indians are 3 to 4 times at very high risk of having coronary artery disease and related problems as compared to other Asian countries or even Western population. And the most worrisome part out of coronary artery disease is the younger population is getting involved. So what used to think earlier a disease of old age beyond 50s and 60s. So now all these coronary artery disease related problems are occurring even at younger age, as young as 20s and 30s and 40s. Even if you see the incidence of the heart disease, not only the heart disease but the hypertension also is involving younger generation. One, probably you can say the lifestyle of Indians, where most of the people lack physical activity. They are kind of not very physically active. Probably diet, and we Indians are genetically as well as ethnically very prone to have cardiovascular diseases. Like we all know, probably we would be a diabetic capital in the world. Probably we are going to overtake China in an incidence of diabetes in a very near future, as well as we already are a coronary artery disease capital in the world. And the most disheartening thing to see is the younger population getting involved, the productive population, the people who are actually meant to work, or the breadwinner of the family are getting suffered, or probably losing lives of these younger individuals. So that's the most worrisome part. The most important thing is that one has to, probably have a good lifestyle, healthy lifestyle, which includes a good healthy diet, probably exercise, and regular follow-ups to your doctor. Probably we used to say earlier, people who are beyond 40s and 50s should have regular follow-up, especially if they have a strong family history or some risk factors. But nowadays we say even in 30s also you should have a regular follow-up, particularly if you have a strong family history or people who are obese or having some symptoms. More than overlooking those symptoms, I would always urge most of the Indians, go seek advice, your consultant, cardiologist, or your general practitioners. Do necessary investigations to try and diagnose any disease, be it heart-related element, be it diabetes, be it any other element, much before it actually hits you. You need a big time awareness of the heart disease, diabetes, any health-related elements, to be more precise, because I think we as Indians take things for granted very easily. Somebody who's obese, I'm feeling breathless because of my weight, but you never know that obese person might be having diabetes. Unless you checked your sugars, you never know you have diabetes, or that person might have coronary artery disease, that's why he's feeling breathless. So awareness is one which we are lacking big way, and that is the reason most of young lives are lost, because of not being aware of their own health condition. We come across so many examples where patient says ki young people, I had acidity kind of symptoms where it was not relieved by medication. I had symptoms for 3 days and 4th day patient was dropped dead. So there are so many examples like this. So one should never ever take things for granted ki any untoward symptom, any symptoms which are not usual, any symptoms which have been new symptoms and not getting relieved with a normal medication, one must seek a medical advice immediately. So awareness at every level, awareness at your community level, awareness at your office or corporate office level, awareness in general public is very, very important.